Now, today I had a client, and this is a girl around. She's 26 years old. So she's having a problem with primary infertility. So she has never produced before, and she's married. She's having emotional issues because she has never had a baby. They have done investigations, and we had to order for HSG. HSG is hysterosalpingogram. It's an X-ray. They do X-ray, and it targets the structures of the uterus, where it tells us whether the tubes are blocked. It finds us to it helps us to find out the whether the uterus has scars, any structural abnormality about the uterus. That is the investigation we usually order for. So we found out that this girl, the the tubes are blocked, and both of them bilateral. Both sides are blocked. Uh, but she has been having some tablets. They have been giving her clomiphene. They have been giving her a lot of fertility tablets that helps on fertility, and to find out that she's having blocked tubes. Therefore, I wanted to share with you, before you start taking some tablets, before you start taking some tablets for fertility issues, for infertility, you need to go and see your gynecologist. Your gynecologist or your doctor, or if fertility doctor will order for such investigations like HSG. HSG, I told you, it's hysterosalpingogram. It helps us to find out what is the cause of the infertility structure, because we have other many causes of infertility. It can be hormonal disorders or ovulation disorders. It can be structural disorders where it involves the fallopian tube blockage, it involves uterine fibroids, and many other things. Then also it can be other factors, that is age. It can be secondary to lifestyle, you are smoking. It can be as well secondary to infections, those STIs. Therefore, it's better for you to go and see your gynecologist before you go to the pharmacy and buy any infertility drugs to help you to get a child or to get conceived. So when we did that, we found out the tubes, both of them are blocked. She had bilateral blockage of the fallopian tubes. So we had to tell her she need to go and see the specialist, where they will do laparoscopic surgery. We can do laparoscopic surgery. We can do tube ligation as well. It can also be a better treatment, and as well we can also do what we call salpingectomy, depending. But in most cases, salpingectomy, it is done when we find out that there is maybe toxic fluids around. It can also we can also out to do what we call salpingectomy. Therefore, you have to know before you go in for any fertility drug. Please, you do investigations. This is a lady who has spent more than 1 million in something which needs to be first diagnosed using investigations. Don't just go to the drugs and you buy clomiphene, you buy those drugs. Others are buying clomiphene, they're buying dufaston, but then they don't